Welcome to our NPTE Question of the Day series, presented by Typical PT. Today, we are going to be discussing a question from Typical PT's platform. Let's jump right in. The question is, in an outpatient physical therapy clinic, a 72-year-old female patient presents with a referral from her primary care physician, PCP, for conservative treatment of persistent musculoskeletal inflammation in the right shoulder. Examination reveals tenderness to palpation of the right shoulder, reduced range of motion, ROM, with active abduction limited to 90 degrees, and a manual muscle test, MMT, score of 4 out of 5 in the affected area of the shoulder. Based on the given scenario, which therapeutic modality would be most appropriate? A. Direct contact iontophoresis with hydrocortisone set to a negative polarity. B. Direct contact iontophoresis with dexamethasone set to a negative polarity. C. Direct contact iontophoresis with dexamethasone set to a positive polarity. D. Direct contact iontophoresis with acetone set to a positive polarity. Go ahead and pause the video right now, think through the logic, and lock in your answer. When you are ready, hit play again to see the solution. Welcome back. The correct answer is choice B, direct contact iontophoresis with dexamethasone set to a negative polarity. Before we break down the explanation, I want to mention that the infographic shown here is from the Physical Therapy Essentials book from Typical PT. You can find this diagram and other helpful resources inside that book. Going back, answer choice B, direct contact iontophoresis with dexamethasone set to a negative polarity is correct. The patient is presenting with signs consistent with musculoskeletal inflammation in the shoulder, specifically tendinitis. Dexamethasone is a potent corticosteroid, which is highly effective in reducing inflammation in musculoskeletal disorders. For effective transdermal drug delivery via iontophoresis, the drug's ionized form must be repelled by the electrode of the same polarity, driving it into the tissue. The quick tip provided states that like polarities go together because they will repel each other and go into the tissue. From the Ions for Medicine table, we can see that for musculoskeletal inflammation, the medicine used is dexamethasone, and its polarity is negative. Therefore, to repel the negatively charged dexamethasone ion, the active electrode must also be set to a negative polarity. Now, let's look at why the other options are incorrect. Answer choice A is incorrect because hydrocortisone has a positive polarity, and the polarity of the machine is set to negative. This opposite nature of the poles would cause them to attract and prevent effective transmission of the medication. Additionally, hydrocortisone is not commonly used in iontophoresis for musculoskeletal conditions, and its effectiveness and potency are less compared to dexamethasone for such purposes. Answer choice C is incorrect, because while dexamethasone is the correct drug, it is negatively charged and needs to be administered under a negative polarity to effectively penetrate the skin and reach the target tissue. Using a positive polarity contradicts the principles of iontophoresis, where the repulsion of like charges facilitates the drug's transdermal migration. Answer choice D is incorrect, because acetone is not typically used in iontophoresis for treating musculoskeletal conditions. Acetone is primarily known as a solvent and lacks therapeutic properties for treating inflammation or pain in musculoskeletal areas, although it is typically used to reduce calcium deposits. Thus, it would be an inappropriate and ineffective choice for this patient's condition. Now that you've gone through this case, take a moment to jot down all the key points in your Typical PT digital notebook. Use it to organize your notes, highlight concepts you found confusing, or mark areas you want to review later. This feature isn't just for note-taking. It can serve as your personal reviewer, helping you track what you've mastered and identify topics you still need to strengthen, ultimately improving your retention and understanding. Thanks for watching today's Question of the Day. We're dropping new NPTE prep content every single day to help you pass with confidence. Follow us on Instagram, Facebook, and TikTok at Typical PT for daily study tips, quick reviews, and motivation to keep you going.